You don't want to lie, and you don't want to say, speak a mistruth, and you don't want to mislead. I think that's probably the most important. You don't want to mislead somebody into thinking the situation is better or worse than it really is. You want to be, honest about the situation, but you don't have to tell them everything all at one time. You can plan to give the basic information first, let the patient digest that, understand it, be able to articulate it back to you that they understand it, make sure their family understands it, and then with time, then you can give them more and more and more information, because now that they have a basic foundation to understand what their cancer is all about and what the plan is, then you can add more and more information on. Too much too fast, I think it doesn't help the situation. I think patients find it overwhelming. It doesn't allow you to connect with them on a more personal level, because you're breaking it down into too many facts and too much data. You want them to have information, but you also want to have time for some empathy. You want to have time for compassion. You need to leave time for them to respond. If they need to let something out emotionally, you need to give them time to do that. And I think if you spend the whole time overwhelming them with facts and figures, you don't allow that emotional part to get addressed properly. My experience has been, when you overwhelm them with the seriousness and frankly the fatality of a diagnosis, and you do it and you just sort of drop it on them, it usually doesn't go well. Usually the end result is not good, either for the patient, their state of mind to begin therapy. Even when we have a bad situation, I think there's still an element of hope that will help patients get through the treatment that they need to get through. It helps with their quality of life. If you can address things like pain and nutrition, we know that their motivation to be part of their pain management and their nutritional support will improve their outcome. Their quality of life will be better, their survival will be longer. And in order to engage them in that journey, between family, patient, and provider, that engagement requires that you be honest with them, but you give them information when they're ready for it. So we don't want to withhold anything from anybody, but there is a time and a place and a way of giving them that information.